Hi guys, Dr. Millie here, and I just want to do a very quick video on the principles of naturopathic medicine. So naturopathic medicine is an art and a science to holistic and traditional medicine. So we look at what the research says, we get informed by Western medicine, but of course we also get informed by Eastern medicine, ancient traditions, philosophy, homeopathy, Ayurveda, Chinese medicine, as well as European nature cure have all informed the way naturopathic medicine is today. So we do tend to have belief both in the science and look to the science, what the science says as to how herbs work and what nutrients are good for what, and diagnostics and Western imaging, etc., for validation and diagnosis. But we certainly believe in a whole body concept. And probably the first principle of naturopathic medicine is vis naturae, which means the power of the body to heal itself. So naturopaths tend to believe that the body has an innate wisdom and ability to heal itself, that homeostasis, which is the body's natural state of being, it's the body's attempt to maintain equilibrium. This is a state of health and healing. This is a state of optimal health, and the body's always trying to work to get to that state of homeostasis. And so we consider that the body's ability to heal itself. If you nick a wound, if you break your leg, the body heals it. Now, it might not heal it straight. You have to get it set. You need medical attention in order to get it set straight, but the body does go down a healing path, okay? So that's the first thing that naturopathic doctors do believe about how to approach medicine. The second one is to identify and to treat the cause. So we don't just want to remove pain, treat the symptoms by suppression or at all costs. We want to dig down, find out why something is happening, why the symptoms are occurring as they are, and look to see the interconnectedness between the organ systems. So when one organ is weak, then generally another organ is compensating, and then that organ that's compensating can look like it's functioning strong or more powerful, and then eventually that one can weaken as well. And so we look at how organs relate to each other. That's one reason why naturopathic doctors tend to be generalists, because no matter what disease we're presented with, we always look at all the organs, what's going on in the entire body. Now, whereas in medicine, we tend to break the body down into specialties, and we avoid looking at the connections. And so with holistic medicine, we look at the whole picture. And in order to get to the root cause, we see what's going on in the digestive tract that affects the mood or affects the skin. We see what the genetic SNPs are, if the liver methylation metabolism is affecting how somebody's ability to process nutrients or foods or chemicals, then they might get pain or inflammation, etc. So we're always looking for the root cause to see if we can treat that. Sometimes the root cause is way far in the past. Sometimes the root cause is a complex, multifactorial process, especially if it's chronic disease like autoimmune, for instance. And sometimes the root cause is mental or emotional. It had to do with the trauma. So you can't go back and take away what happened, but you can change the way that the body and the person is responding to that, and thereby change the body's reactivity. The third one is do no harm. So at all costs, we do not want to give toxic chemicals in the body. Now, sometimes naturopathic doctors do use medications. Sometimes we do use toxic herbs, but the overall is the weighing the pros and cons of the interference, the harm that the intervention is going to do versus the benefit. So we're always siding with, going with not injuring other organs or injuring the body generally in order to produce a cure in one area. So we would not want to support lowering blood pressure if this is going to just cause the kidneys to be diseased. We do not want to engage in toxic chemicals for taking away cancer if it's also going to kill living and vital cells or deplete the vital force of the individual. Not that we don't want to kill the cancer cells, but we would support a lower dose or a less toxic herb or a toxic herb in short doses, and try to get to a point where it makes sense for the individual to be taking that remedy. Because if you're just killing the healthy vitality of the individual, then how well off is the individual likely to be in the long run? How good is the prognosis likely to be? So we're always trying to build health, actually, while even if we're treating difficult and chronic diseases with a poor prognosis. Doctor as teacher. So the doctor is there to provide guidance and education so that the patient learns about themselves. So it's not just about telling you what to do, telling you what to take, but also informing you why I would like you to take that, why something's happening to you, why when you eat avocados you want to vomit, or why when you eat deep fried food you get gas and bloating or heartburn. So there's always an educational aspect, so that an individual is understanding how their self-care and how the choices that they make on a daily basis is going to affect their health in the long run, or even in the short run, meal to meal, how what you're choosing to eat right now is affecting your level of pain or discomfort or headache or anxiety. And so that's something that is very important, is that we educate, and not only educate our patients, but also educate the public on naturopathic medicine, on wellness, on prevention, on the harms of GMOs, on the nutrients that get depleted by medications, by the side effects of medications. Not so that you never take a medication, but so that you're educated and that you know what's going to happen, so that you can prevent the side effects, or so that you can make yourself healthier and prepare for to deal with what the choices are, or how toxic chemicals are cancer causing, how the chemicals that you're cleaning your toilet with might be giving your dog cancer, or even promoting cancer in yourself. So we educate as part of this, not to induce fear, but so that people know and can make the appropriate choice for them. Treat the whole person. So as I mentioned when I was talking about the root cause, it is not just about dealing with symptoms. It's not just about looking at what's happening in the organ that's displaying the problem. Like a naturopath would never say, oh, you have one question, you can ask one question, because we don't even believe in that philosophy. We believe that everything is complicated, that all organs are relating to each other, and also not only just on the physical level of treating the whole person, but also treating the whole person from a mental, emotional, environmental, physical, biochemical, a spiritual perspective, right? We've heard of mind-body, you've heard of mind-body-spirit. So we believe that all of these need to be addressed, because if there's an imbalance, or if there's a hazard or a harm going on in any one of these areas of one's life, that can lead to chronic disease, that can lead to illness. And so, for instance, if you make all these changes in your diet, but you're still living in an abusive household or in an unsafe environment, or you're still using tons of toxic chemicals, then your body might not be able to heal and recover in the way that it's supposed to. So we always, or if you're feeling very badly about yourself and your self-esteem is very low, and then you're still likely not going to be able to recover fully from a chronic disease, even if you're eating everything that's right. So we always want to treat the whole person, all aspects of what makes the person the individual self, and also what might contribute to their disease, and also what might contribute to their wellness. The other thing that I want to say is that an individual is never the diagnosis that they're given. So just because somebody's given the diagnosis of an autoimmune disease or a diagnosis of cancer, even if it has a poor prognosis, that is never the individual. There's always wellness within an individual. There's always an aspect of health that we can build upon, even if there's a disease process going on. And so a human being is never, as long as a human being is living, they are never completely sick. They are never completely just their diagnosis. They are also this other aspect of themselves, which is the roles they play in their life, which they love: a mother, a brother, a father, a son, a parent, a doctor themselves, a nurse, a salesperson, whatever you are in whatever you prize for yourself, whatever you enjoy, a yogi, an athlete, a jet ski racer, whatever you are in your life. These are also aspects of yourself, never just your disease. And we focus on prevention when all possible. Just like Ben Franklin said, an ounce of prevention is worth a pound of cure. If you start a disease before it's actually diagnosed, then you have much more chance of changing the course of it. So for instance, if we take seriously the symptoms that are presenting themselves even before there's any kind of diagnosis as possible, so you feel off, you feel like you have constant bloating or heartburn, or you have all these headaches, or you have joint pain, but you don't have a diagnosis yet, it's like your tests come back negative, there's nothing wrong with you. So you can go to tons of specialists and they could keep on looking to see if there's any diagnosis, but if there's no diagnosis, then there's not usually a treatment that's possible within medicine. So they just kind of, tell you to wait, right? Go home, whatever, take Advil, or do the best that you can do. But in naturopathic medicine, we look at preventing diseases while they are just going. So if somebody has chronic pain, even though they don't have an autoimmune disease, even if they don't have a positive ANA, but they've got joint pain all the time, then I'm going to be looking to see what's going on. I'm going to be looking to see how we can heal the gut, where the inflammation is coming from, if there's a virus, if there's a bacteria. So it's very important to prevent and address chronic symptoms while they're happening, try to get to the root cause of those, instead of watchful waiting, instead of waiting for a disease to happen. Because once a disease happened, it is much more difficult to treat naturally, and it takes a much longer time, and by that time then you're in the medical system, and then you need medical intervention. Whereas if you can address it before you require medical intervention, or even just while you're doing over-the-counter or some simple approaches in medicine, it's much easier to treat from a natural perspective, or be able to get off medications and things like that. And then lastly, and I've hinted at it already, we do focus on wellness. So there's always a focus on how to get to the body to that optimal healing place. And if you can get the body well with enough nutrients, eating enough vitamins, minerals, plant chemicals, antioxidants on a daily basis, doing exercise, making sure that you're breathing, making sure that you're sleeping, engaging in all these positive lifestyles, good coping mechanism, not drinking or doing drugs in order to cope, or doing something that's harmful or manic for yourself. So there's all sorts of ways that we can intervene to help a person be well. And when a body is well and adjusted, then it just will have a better immune system, and therefore able to recover from diseases, even chronic diseases, that much quicker. This is why there's a tie to insomnia and obesity and osteoporosis and cancer. And this is why shift work reduces one's life expectancy by 30%, because there's not a wellness component when there's such a rough lifestyle. The body can't really be well. And so always trying to, replete nutrient depletions, recover and heal or prevent and treat chronic symptoms, reduce inflammation, get those lab markers, but also the symptoms to a place where they are no longer expressing themselves in this way. And this is how we exhibit wellness, and this is also how the body recovers from symptoms naturally, and we'll be able to be in homeostasis without having to throw off some organ system, because the body actually has an intelligence. It's trying to maintain the health and the survival of the vital organs, and sometimes it won't prioritize having hair, or it won't prioritize warm toes and fingers, or it won't prioritize stress management, because it's really just, it needs all the nutrients that it has in order to focus on keeping the blood pressure somewhat moderate, or if it can't even control the blood pressure, then it's trying to protect the kidneys. So the body's always trying to save you, but in doing so can bring about some very nasty symptoms. And so promoting wellness allows the body to not have to go to those extremes and to be able to deal with the symptoms naturally. Then there's one more, principle, which is doctor heal thyself. So naturopathic doctors, when they're going through school, when they're going through their training, it's a 4-year postgraduate training before you do your NPLEX, which are your international licensing exams. That's standardized between Canada and the United States, all the naturopathic medical exams. And while the whole time you're in school, you're also trying to address your own conditions, your own health conditions, your own food sensitivities, your own allergies, your own stress management, your own, OCD, depression, anxiety, eating disorders, whatever a person is challenged with, family problems. And so the doctor's really gone through this. By the time you're a naturopathic doctor, you've gone through this whole 4-year process of being on this self-healing course. And I don't think it ever ends. There's always, naturopathic doctors do tend to practice what you preach because they instill it within us that we are one just like everybody else. We are a patient also of naturopathic medicine. We are not just this hierarchical figure that tells people what to do and tells them what's wrong with them. So that's why naturopathic doctors are such good listeners and such good counselors, and why we're so compassionate and sympathetic, and we spend a lot of time with our clients and our patients, and we really try to help them in all these different ways because we've also gone through it. And so empathy is a massive part of medicine. Benevolence is an extremely important aspect of medicine. Now it's called narrative medicine, where we listen to the patient's story. Patient's story is very important because not only does it give all the cues as to how to treat the person, because really people tend to tell you what's wrong with them and what they need in order to recover. They tend to say that if you give them enough time, but also just allowing an individual to express their story and giving them the time and the space to do that and to go through their own theories and connections, and it allows them to recall things that they had forgotten, that nobody's ever asked them before, and put pieces together and link up pieces of their own puzzle, which allows them to make those changes from the inside out. Because when a person makes a realization, has an epiphany about their own health as to what they've been doing that's bringing about a negative result, they can finally have that epiphany and then make those changes. So I think that's pretty much all I want to say today, guys, about the principles of naturopathic medicine. Give me a shout. Let me know what you think. Leave your comments. I'd love to hear them. Don't be nasty, though. I don't like that. I'll block you. And otherwise, like, subscribe, share. I am building up to have a course on Udemy on naturopathic medicine, so I'm just doing these snippets, educating you on naturopathic medicine as I'm going through my materials to do that Udemy course. Okay, thanks so much, guys. Have a great day. If I can turn it off.